Biodentine. Brought to you by Septodont. Inside a box of Biodentine, there are 15 capsules, each containing 0.7 grams of powder, 15 filled pipettes, a capsule stand, 15 spatulas, and a laminated instruction leaflet. Tear open a foil-wrapped Biodentine capsule. Keeping the capsule upright, remove the white cap and place the open capsule into the stand. Open the pipette package and snap off one pipette. Twist and pull the pin out of the top of the pipette. Then, holding vertically, squeeze the pipette and maintain pressure until 5 drops have been dispensed into the capsule. Close the capsule with the white cap and place it into a mixing device at a speed of 4,000 to 4,200 vibrations per minute. Mix for 30 seconds. The correct consistency will show a line of Biodentine along the capsule when you open it. Collect the Biodentine with the instrument supplied in the box. Depending on the desired application, you may handle Biodentine with a flat plastic or appropriate instrument for the procedure. When placing Biodentine, do not pack the material, only puddle it. Immediately rinse and clean the instruments to remove any residual material. Final restoration of the enamel can be applied after the 12-minute initial set or during a second appointment within 6 months. Tip: if using a 2-stage technique, we suggest filling the tooth and cutting back the Biodentine at the second appointment. Troubleshooting. Holding the pipette incorrectly can result in a bubble forming in the liquid and an incorrect amount of liquid being added to the powder, thus affecting the consistency. The whole process takes only 12 minutes, split into a maximum of 6 minutes mix and working time, and the remaining 6 minutes to final set. After placing as desired, do not touch the surface.